hear me?
Yes, I can. Good afternoon, everyone. Can you guys hear me okay? Can everyone hear me okay? All right, great. Thank you for joining us today for this Zoom call. We're just going to get started here with an update from Assemblymember Dr. Shirley Weber. Please give us, and first off, just want to start, I'm sorry, before we get started with you, Dr. Weber, I'd like to have everyone please give a moment of silence for those that are suffering and for the Floyd family. We're just going to mute momentarily for a moment of silence. Thank you. Dr. Weber, thank you for your service. Thank you all for joining us today. I just want to thank the community and for those that are tuning in for joining us. We have a lot to talk about with a short amount of time, and we thank you guys for breaking your schedule to update the community on everything that's going on, which is a lot. Those that have been invited to today's meeting this meeting is hosted by the San Diego Hip Hop Health and Wellness 5K and Festival. We're just going to allow the floor to go to our esteemed leader, Assemblywoman Dr. Shirley Weber. Make sure you guys unmute your phones. For those that are speaking, please mute your phones. Dr. Weber, the floor is yours. We'd like an update on everything that's going on in the state capitol, and your thoughts and your leadership will guide your introduction to today's news. We appreciate you. God bless.
Carlton, thank you, and thank all of you who are on this call. This is probably I don't know what number Zoom it is that I've been on today, and have 2 more to go as soon as this ends, and another one tonight. Clearly, if we had had this conversation, about a week and a half ago, 8 or 9, 10 days ago, it would have been a completely different conversation because we'd all be focused upon the virus and how the state is responding to it and its impact on the Black community and the work that folks like Dr. Afflalo and Dr. Hood are doing to try to bring testing to our communities and all those kinds of things. And those things are still there. They're still, and hopefully people haven't forgotten them in the midst of everything that's going on. But in addition to that, things are happening in Sacramento. Obviously, the most recent issue with George Floyd has pricked the hearts of an entire nation and really an entire world, and has obviously brought into view the real issues that we face in California. And so, as chair of the California Legislative Black Caucus, we have been our press conference the other day, and our efforts have been to make sure that people stay focused upon not only just the virus, but the rationale behind what we're facing in the streets. As we get a lot of folks who come to us with the caucus, and every caucus group is wanting to help in some capacity. And oftentimes they want to take the issue and turn it into their issue. We've gotten resolutions that this is really a reflection of bilingual education and immigration, and it goes on and on and on. And our concern has been, as we've stated in our press conference and others, that we have consistently as a nation refused to deal with the issue of race and particularly slavery in this country. And as a result, we have tried to solve everybody else's problem. And in the end, we still find ourselves the one group that is the most demonized in many ways and have the most negative impact of anything that happens to us first and foremost in the most profound way. And yet for 400 years, no one has really dealt with the issue of slavery in this country and its impact upon health, its impact upon employment, upon wealth, upon everything that we face, as well as its impact upon the training and what happens in law enforcement. So the Black Caucus has tried to explain to all of its colleagues in the Capitol that this is really a Black issue. This is not a diversity issue. because every time we address diversity, somehow or another, we never get in the pot. You know, everybody gets something out, everybody gets their issues addressed, and we're still standing there waiting for someone to talk about what is happening in the African American community. So we have made our efforts to try to make sure that we stay focused upon that particular issue if we're going to deal with as we're dealing with the governor, as we're dealing with everyone else. We're at a time at the Capitol where we are finally, after coming out of aspects of the pandemic, that we're meeting again. And as a part of that, there are two major pieces of legislation that we are highly focused on that have some direct impact upon not only the virus, but has a direct impact upon the things that are going to happen for African Americans in the state. Most of you know we did 392, and everybody's now praising it as they fought it tooth and nail as we were trying to get it passed last year. We fought valiantly and won that battle, but nobody believed that there was really any overuse of force in African American community. We forced them to do that. We forced them to see it. And now, of course, my colleagues, and whether it's the Speaker of the House or the governor, all are singing the praises that thank God we passed 392. California is better than everybody else, so they think. But we have two other bills that are really important. One is, as people have said consistently, we are trying to do ACA 5. ACA 5 will repeal Proposition 209. It will once again restore California so that California can consider race and gender in its contracting, its employment, and every aspect of life in California. We're only one of 8 states that don't have affirmative action, and therefore don't have a vehicle in which we can target populations to address some of the issues that we face. One of the problems with Prop 209 was that most folks thought it would only address very small issues in California, and yet it addresses every aspect of California. So that if we are trying to solve a health issue, we can't focus upon African Americans. We can't mention that as an issue in addressing the issue. We have to talk about poor people. We have to talk about people who are bilingual. We have to talk about something different, but we can't talk about people, African Americans or Latinos, anyone else. So we have Proposition ACA 5 is now going to the floor of the Assembly this week. It has gotten out of committee. It was supposed to be dead in committee. We only had 3 votes. We needed 4. And after I came out of committee, we had 6 votes to get it out of committee, 6-1. We then had to go to appropriations, and it came out of appropriations yesterday. So we will be going to the floor of the Assembly next week. It's a high bar to pass. We have to have 2/3 votes, so we have to have 54 of the 80 members, and we have a couple of members that are not present. So but we still have to have 54 votes of the Assembly in order to move it on to the Senate, a 2/3 vote. After we do all of that, then it will go to the voters for November. So we are working furiously to get our 54 votes. We have 61 Democrats in the House, but probably only about 45 that really count. So we have to push all of the others to do the right thing and to accomplish that. So that's been my work and my goal for the last few days. In addition to that, we have another bill that just got out, and it's a bill for reparations in California. And it has gone through committee and appropriations, and it will be on the floor of the Senate. We expect it to pass. And it is forming a commission in California to deal with the issue of slavery in California and the impact of slavery on California laws. We participated in the fugitive slave law. We returned people back to their owners. We allowed them to practice slavery in the United States. We didn't sell them in our minds, but nonetheless, we allowed slavery to live and to practice in California, and insurance companies to profit from slavery in California. So we are calling for the development of a commission. And in the next year, the commission will come forward and present to us ways in which California needs to change and needs to deal with the issue of reparations and meet the needs of African Americans in California. So those are the 2 major issues. We have a number of other things that are going on, but those are the 2 major issues that's happening right now in California in the legislature. And we're trying to very hard to make sure that the focus is upon us. We have met with the governor, and And we've also stated with him, this is before the Floyd issue, when we were dealing with COVID, is that we recognize that our communities were suffering the most in many cases. Most of us were essential workers that were still being exposed. And as a result of that, we have gotten from the governor some assurance that, and it'll be reflected in the budget, that there will be additional support for our Black businesses, because when our Black businesses, all the grants opened up, everybody got them but us. And so now we're back to get our Black businesses to get the grants. We've got many of our churches to be identified as small businesses, so that they can basically, because of the programs and the services they offer, to have some level of support for them. We've gotten over $50 million to be laid aside specifically for those individuals. And so we're working with the governor, and our position with the governor is that when the virus hit, like everything else, when Black people, when the rest of the world catch a cold, we get pneumonia. And so our attitude is that, therefore, there has to be some extraordinary efforts to help us rebuild our community and rebuild the businesses and the things that are there, and also to rebuild the educational programs for our kids, having missed so many weeks of school. So the governor has committed to that, and our position is we do not want to recover. We want to come back better than we were before, because to come back in the same position with the same kinds of things we had before simply makes us vulnerable to the next pandemic, whatever it may be. So we're working hard to make sure that the governor stays focused upon the issues that affect African Americans, and that the recovery efforts have to be better than before, and not just coming back in the same condition that we were before. So thank you very much for the opportunity to be here. More than happy to answer questions when it's appropriate, but we are working hard to make sure California is a part of that African Americans are part of the agenda in California, a very significant and powerful presence. We want to make sure, and that we don't get caught up and be taken off the track and going in some direction that has no benefits for us. So Carlton, thank you very much. Carlton, we're partnering this weekend. I forgot, we're partnering this weekend with our hip hop group, and I'm sponsoring the food giveaway and the PPEs at Mount Erie Baptist Church, I think from 3 to 5. So I'm honored to be able to partner with you and to make sure our community has what it needs in terms of food as well as protection. Thank you.
I can't thank you enough, Dr. Weber, for your time. I'm going to introduce and turn over the meeting to our event host. She just had a small technical delay, so she's here. Her plane has arrived. Everyone say hello to San Diego Hip Hop 5K's business admin and moderator, Kristina Buckner. Kristina, you have the floor. I know that she has a couple of questions for Dr. Weber.
Thank you so much, Carlton. I do greatly apologize. I had a little bit of technical difficulties getting on here, but we are here nonetheless. If you are watching this webinar, we want to thank you for tuning in to our second series of our health and community during COVID-19. And now we have some other things that have been included, I think, in this discussion, because it all involves your health. We have some experts within the community that have some great insight and information that you might not get anywhere else. So please tune in. We will also be having these regularly, so please stay connected through our Instagram page, our Facebook page as well. As I said, my name is Kristina Buckner. I'm with the San Diego Hip Hop Health and Wellness 5K team, okay? I first want to introduce you to the panelists. We have several panelists here, as you've heard from Dr. Shirley Weber. I don't know, I didn't catch if she did a thorough introduction of herself, but I will go ahead and give an introduction for her, because it's very important that you know how powerful this woman is, okay? Dr. Shirley Weber, she was elected in November of 2002 and represents the California 79th Assembly District, which includes Bonita, Chula Vista, La Mesa, Lemon Grove, and National City. Dr. Women chairs the Assembly Budget Committee on Public Safety and the California Legislative Black Caucus. Dr. Weber is a member of the Assembly Standing Committees on Education, Higher Education, Elections, Budget, and Banking and Finance. In addition to several boards and committees, I was astonished. I had to kind of cut this short. It was just so long of accomplishments. She has also, not to mention here, but Dr. Weber introduced and passed a historical piece of legislation, which I believe I got into the discussion, was AB 392, known as the California Act to Save Lives, which is huge. With her commitment to education and social injustice, we gladly welcome Dr. Shirley Weber to our discussion today, and we gladly take in all your input. So thank you so much for being here, Dr. Weber.
Thank you.
Next on our panelist, joining us again, we have Dr. Jerome Robinson. Dr. Jerome Robinson is a cardiologist who has been serving the Southeast San Diego community for over 35 years. Dr. Robinson is a board-certified cardiologist who specializes in cardiac and hypertension. Dr. Robinson is also a fellow of the American College of Cardiology, the American College of Physicians, and the American College of Hypertension. Please welcome Dr. Robinson to our discussion panel today.
It's a pleasure to be here again, and it's a pleasure to be on a panel with a person I hold in high esteem, Dr. Shirley Weber. I want to give you a quick update on COVID-19. COVID-19 is here, and it is still prominent in the community, and probably will be here for the next 18 to 24 months, despite what you may have heard. In the county, in terms of an update, we've had about 283 deaths, 7,789 total cases, with 369 currently hospitalized. Moving, I want to talk a little bit about the importance of testing. I've advocated testing, testing, and testing, because that's the only way we're going to figure out who has this disease so that we can isolate them, we can quarantine those who have been exposed, and we can cut out the transmission of this disease. I want to mention that a negative test doesn't mean you're clear of this virus. It depends on what time you were exposed to the time that you were tested, so that you can still have this disease even if you've tested negative. And also remember that there are a number of people, and that number keeps increasing as we hear from sources like the CDC as well as the military. Dr. Redfield from the CDC says that up to 35% of people in this country are asymptomatic carriers, which means they've had no symptoms of the disease, but yet shed virus and infectious. I want to mention too that rapid tests that everybody's been talking about is probably inaccurate. As you recall, going back several weeks, the President of the United States was being tested on a daily basis with the rapid test. It's only about 48% positive. And so at Paradise Valley Hospital, they've done away with using the rapid test. Antibody testing, we hope, would give us a clue as to who has had this disease in the community, so that we can then look to see whether or not herd immunity would be possible. We know from experiments that have been done around the world, Sweden, for instance, didn't close its economy. It gave its citizens a chance to wear masks, social distance, and everything else. However, the mortality in Sweden was the highest in all of Europe, 39 per 100,000 of their citizens. Compare that with Norway and Denmark, or Norway and Finland, who had 4 to 5 per 100,000 of their residents that were positive for this virus. The United States and the president of this country has nothing to be proud of, because we are at 29 per 100,000, not very far from Sweden that didn't close their economy. Antibody testing, we thought, would be a great help to determine who in the population has had this disease. However, antibody tests to date have not been accurate and probably are not yet ready for prime time. Access to testing is still a problem. Dr. Afflalo will update us on how the testing has gone in the community. But just in Councilmanic District 4, there are somewhere between 150 to 200,000 people, and we have not begun to test the surface of testing, and that's important. Moving on to the next slide. There are lots of therapies that are currently under investigation. If you go to the government website on testing and current things that are in development, there are approximately 69 different drugs that are in some form of testing. We've gone back to look at some of the antiviral drugs that have been used in the treatment of AIDS. And even some companies have proposed a triple therapy that's even been effective in the lab against this COVID-19 virus. However, they're still not ready for prime time for the rest of the population. The hydroxychloroquine azithromax story is a complicated story, but the bottom line is that that combination of therapy has not been effective in terms of this virus. And in fact, it's been reported that the mortality of those getting this treatment is probably twice that of those who do not. Recently, as of today, some of the studies that have been reported out, particularly the large government study that was reported out, some of the reviewers have had some retraction of some of the data. And the American Journal of Medicine, the Lancet, have also retracted that article as it appeared and was printed as a peer-reviewed journal. So stay tuned, there's still more information. There are a lot of other therapies that are out there. Everybody's heard of remdesivir, which has shown about a 4-day decrease in hospitalization among those that they have treated with this disease. There's also been IL-6 inhibitors, which is one of the inflammatory cytokines that the immune response generates. And by blocking this IL-6, they hope to be able to block the cytokine storm that causes some of the damage in terms of its effect on kidneys and heart, which are quite important to those patients that have this severe disease process. However, again, none of these therapies have been definitive. They've been used under emergency use authorization given by the FDA for patients in various forms of research protocols. Moving along. As we open society, it's going to be very important in terms of what we do. And just to emphasize again, just because you have a negative test does not mean that you can go out and be carefree. You're still going to have to adapt to the new normal, which means that you're going to have to wear masks to protect yourself and your family. Remember, many of the people in our community are the essential workers, and they cannot stay home because they have to support their families. Many in our community are multi-generational families that are all living together, and that's important. So we need to test, and continue to test. But remember, physical distancing, not social distancing, wearing masks, gloves, carrying your antiseptic with you, and washing your hands, and remember, just clean, clean, and clean. Remember, those most impacted are communities of color, essential workers, those frontline service folks that we all know so well. We go to the pharmacy, we go to the drugstore, we go to the grocery store, and there are a lot of other services in the community that we see the frontline workers are at risk, and they can bring this home. Many of my colleagues are distancing themselves from their families. A couple of my critical care pulmonary specialists are staying in their garages because they're afraid to bring this disease home to their kids. And one other thing to mention in terms of kids are not out of the woods for this. There's the pediatric multi-system inflammatory syndrome that's really been discovered. And you've seen reports on the news where some of the folks who have been infected, the kids, have had even cardiac arrest. So it's something we need to be aware of and concerned about, and may definitely be related to this COVID-19 disease. So the things that you can do is stay healthy, eat healthy, continue social relationships, because one of the things that has not been mentioned very much, and that is, what about our mental health in this era of COVID-19? So we need to talk about that and make sure that everyone has some access to get help if help is needed, and have outlets for stress. Moving on to the next slide. Remember, we have testing, and testing has its own inadequacies, which would take a big discussion, but test, and maybe essential workers need to test often and frequently. If you can, stay home, stay well hydrated. If you're going to take medicines for pain, if you're going to take Tylenol, which is what's been recommended, make sure that that dose is less than 3,000 milligrams per day. It is associated with some liver problems, and in some cases with kids, it's been associated with some other syndromes affecting the liver. So I'll just remind you of that. And the most important thing is be safe out there. Have respect for your family. Have respect for your elders. Remember, this disease process it most affects those in the older age group. And so you don't want to have an adverse effect to those folks that you hold dear. And I'll just end there, and I'll be able to answer any questions you might have.
Okay, thank you, Dr. Robinson. I was going to continue on, as far as Q&As, we're going to go and with the Q&As at the end. I do see a comment, somebody thanking us for this discussion panel. Although Dr. Shirley Weber does have a time limit today, so I do want to direct any questions that anyone may have directly for Dr. Shirley Weber to go ahead and ask us now. Dr. Weber, before we move on with the rest of the discussion, I know your time is valuable. You had a lot to do with the bill that was passed, the excessive force bill and keeping us safe. How do you feel that's related now in this current climate? You know, I know this is a COVID-19 discussion, but also we want to keep everybody safe and healthy. So what is the importance of that bill? And how do you think the importance of that bill is moving forward?
Well, obviously it's extremely important because the bill talks about the use of lethal force. And it doesn't necessarily limit lethal force to just the use of guns and knives. It talks about any force that can basically cause severe injury or death. And the standards for the use of that is that you can only use it when your life is in danger, or someone in the immediate area's life is in danger, or the person who you're pursuing has obviously committed some type of high felony that has put people's lives in danger. So if you use that as a standard for use, then what happened with Floyd would never have happened because he was not putting anybody's life in danger. He himself was not had not committed a crime that was a crime that threatened other people's lives. And he had already been handcuffed. And so those who were involved should have recognized that this force that they used was not in proportion to the crime that they alleged that he had committed, and would not have used it. So beginning to talk about force now, I was listening the other day and on CNN, some of the members of the Congressional Black Caucus are talking about developing the same policy, 392, and so some of the other states are talking about doing it. California is the only one that has it as a mandate for the entire state. Seattle has it for its city, the couple other cities that have parts of it, but California is the only one that has a state mandate with regards to the training of officers concerning de-escalation, because if circumstances, if they don't meet the standard for using of lethal force, they're supposed to apply de-escalation strategies. So all of our officers are to be trained in the next year and a half or so to participate in de-escalation strategies. And that bill also gives it also changes what we call the fleeing felon law that had been in existence for over 150 years. And that allowed officers to shoot people in the back if they thought they had committed a felony, any kind of felony, stealing a piece of bread or whatever may have been in the past. So now it has to, you can only shoot a person if you believe that they have committed a crime that really puts people's lives in danger, and they have the propensity to do that again. Otherwise, you cannot shoot a fleeing felon because, or anyone else in that sense, if they're not putting someone's life in danger. So others are looking at 392 now as a national policy. They've been talking about it on CNN, and what have you. So that bill would have made a tremendous difference in the training of those officers in Minneapolis. And clearly it would, and it does, the other laws still allow them to be prosecuted as a result of it. So 392 is considered the strictest law for use of lethal force in the nation. And it's a statewide law that now people are looking at for other states as well as a national policy.
Thank you so much, Dr. Weber. I think that gives a lot of people listening here, our viewers, and maybe even people here on the panel, some insight as far as the safety that you made sure that we had here in California. So we do highly appreciate you. I know you have things to do. If anybody else has a question, I don't see any questions in the chat. Do any panelists have a question for Dr. Weber?
Richard Johnson asked something, I guess. How do you make police agencies effectively monitor themselves? Are citizen review boards given enough power? I think they may not have heard me in the beginning, but we did address the issue of police review boards and that they need to change, and there's going to be some policy things coming out. Los Angeles has changed its police review policy so that they've given their police review boards the subpoena power, as well as they have a parallel kind of evaluations going on between the in-house review as well as the outside review, and they can take up issues that were not given to them. Right now, our police review board can only deal with the issues that the police bring to them. But if a citizen filed a complaint, they could not take up that as a part of the review board and do an investigation. So we are looking to strengthen police review boards so people have some sense that there is some transparency and that there's a dual track of doing that. You make police agencies respond to the effectiveness of the monitoring by obviously the prosecutions that occur within a police review. No city wants its police force or police chief prosecuted for not following state law. If it's state law, you have a right, you have responsibility to follow it. If not, then our attorney general can file complaints against that particular agency. It can also obviously be taken over or put under review by the Office of Civil Rights or the Department of Justice at the state level as well as the federal level. So state law is the law. And when it is the law, you can enforce that law. Yes.
Thank you, Dr. Weber. You're more than welcome to stay as long as you can. I'm going to move on to our next panelist here. Just so we stay in accord here, I'm going to skip a few here, go on to Dr. Kelso. I will be back with Alex. I know we had you next on the agenda. Officer Kelso has been a resident of San Diego since 1987. He resides in Southeast San Diego with his fiance, and together they have 5 children. Officer Kelso is with the Black Officers Association of San Diego. He is also has been with the San Diego Police Department for 30 years. He lives currently in Southeast San Diego. He is a graduate in organizational leadership and has a graduate degree in criminal justice. Officer Kelso, we just had this discussion with Dr. Shirley Weber, and it looks like she just left us. In this conversation and in the current climate, we have so much going on right now, which this is, I think, a perfect discussion. We have somebody who's in the lawmaking and just, is discussing excessive force. And here we have a police officer who is of color in our community. We would love to get your input on how much, Lieutenant Kelso, how much this situation means to you as a Black man being an officer, your safety as well as the safety of your community.
Well, first of all, I'd like to thank you very much for having me on the call. As you said, being a Black officer, this sort of situation that we're seeing right now, the death of George Floyd, which was tragic, which was definitely unnecessary, hurts our Black officers. They are experiencing pain. They are bringing that forward to us to tell us how difficult it is for them to navigate these circles right now, because there's just so much tension and rage and anger that even though we wear the uniform, we all still feel, all right? It is very, very difficult for them right now. And a lot of them have even expressed whether or not they want to even continue in law enforcement, just because we know coming out of Black communities like I did, law enforcement is not typically one of the jobs you take. In Black communities, you are definitely directed away from being a police officer. And a lot of us took the job because we wanted to be able to make a difference in our communities and help out and try to change that narrative. So it's really important that we be at the table during these conversations, all right, and that our voice is heard, because we speak both languages. We speak the language of law enforcement and the agencies that we work for, but we also speak the language of our community, all right, and we understand what our community experiences, and we experience it too, both ways.
Awesome. There's been a lot of protesting going on, and I think I haven't heard too much going on as far as the destruction and some of the looting that has been happening. I think it's calmed down. Is that what's happened? Have we seen a drop in the looting and fires and such, or has it pretty much stayed the same? What is your input on that?
Well, from what we're seeing, things are still active. We haven't seen what we originally saw on the weekend, especially with La Mesa and some of the other areas and some of the looting and destruction, right, which is never the right thing to do. But we still have different protests going on out there. Most of them appear to be peaceful, which is a good thing, right? But unfortunately, San Diego did see some lootous behavior and some rioting.
And I mean, what, as an officer, as a lieutenant, here in the force, being a long-term resident, living here in Southeast San Diego, what commitments to anybody, any of our viewers watching now, what commitments can you vow to them to keep them safe, now and in the future, as your commitment, as a Black man in the force?
The Black Police Officers Association has been here since 1974. And our commitment has always been to our community to be a voice of reason, to be a conscience of law enforcement, to work internally within the system to support changes that will make things better off for all citizens, but particularly our Black communities, because we come from them. So we're committed to continuing to work with our police agencies and to work with our communities to be that buffer zone, that liaison in between, that place where people can bring their concerns about law enforcement, and they'll be heard and they'll be taken forward to law enforcement leadership, right, to see if we can, come up with reasonable change and mediate things out. Sometimes I think in our community meetings, when you have executive leadership of law enforcement, those meetings can get a little rambunctious and get out of hand. And next thing you know, people are yelling and screaming at each other. No one's really listening. But when we talk to people, it's usually in smaller settings or one-on-one, and we really can get enhanced dialogue that maybe the chief of police cannot get, because there's a lot of cameras and media, and everything he says is policy. So it's really helpful to have organizations like the BPOA, and not just the BPOA, but there's an organization for Hispanic police officers, Asian police officers, LGBTQ police officers. There's organizations for every demographic that work as liaisons between the police department and the chief.
Great. A couple more questions. One being, I think one of the biggest concerns with African Americans in the community is, in this particular circumstance with George Floyd, there was not one officer, there was a total of 4 officers that kind of took part in this. And I think it's a lot of people are saying, what's a brotherhood? And, some officers are afraid to speak up. And it's a sad thing. But, how do we hold people accountable? How do we hold your captain accountable? When things aren't being addressed, or they are, but being, pushed under the rug. How is that being handled? And, how, if any, ways are you doing, let me see, how are you taking anything upon your responsibility as, an African-American man in the force?
We certainly have a responsibility to speak out when we see wrong and injustice. The BPOA has done that. We continue to do that. Our national organization is called the National Black Police Association. They released a statement that immediately went out to all their chapters, and that went up on all the chapters' social media. Individually on the San Diego BPOA social media, we've discussed the issue. We've put up a lot of content that really reflects how we feel about these issues to our community. We've spoken to the chief, right, and several of the other chiefs about these issues. We're encouraged, though, that it's not just us speaking up, especially on this particular issue. We are seeing police officers of all colors, right, and police chiefs speaking out on how wrong the issue with George Floyd leading to his death in Minneapolis was. And and they're asking for those officers to be prosecuted to the highest extent of the law. And that is different. That is different. We have not seen that before universally, where so many law enforcement agencies are coming forward and speaking against it. And that's going to really help make things better when accountability is real, is established, and when an officer does wrong, all right, then they have to be held accountable just like anyone else does.
Well, thank you so much. I think, the community hearing from you in this current climate is very important, as well as the voices of other officers as well. I think, violence kind of plays hand in hand. And if you feel like you're there, the people who are there to protect you is not protecting you, it's a scary feeling. I'm sure you know where that comes from. So I thank you highly for being on this discussion panel today. I thank you for your efforts and your attempts to keep us safe. And if there aren't any new developments that do come up, we'd love to have you back on as well. So thank you so much for joining us.
One other thing, just that's really important for the people on this call and the listeners out there on Facebook. Our officers, especially our Black officers, are really, really angry and hurt by this. And if there's anything, give them some encouragement. Know that they're out there. Know that they took the job to help make things better for all communities, but particularly our own community. And we really need your support.
Thank you. Thank you. I think it goes both ways. and we welcome it. So.
Together. We're in this together.
We're in it together. We are in it together. Thank you so much. All right, guys. Well, next on the panel, I have COVID-19 survivor. He is Alex Gomez. He's joining us today. He has a wife named Elizabeth. She made all the connections, he says, while he was he has a very trivial story you're going to hear, a little bit about what he went through when he acquired COVID, how long of a process it was, his symptoms, and he's a native San Diegan as well as his wife. He's still recovering now, but he says probably in 3 months ahead where he should hopefully be fully recovered. Is that it, Alex? Are you still kind of now?
I'm about 3 months ahead of where they should. It's a 6-month process, but I've only been out 6 weeks.
Wow,
and
it's a total of 6 months they say for recovery?
Yeah, and it's like somebody recovering from pneumonia. Wow. But mine was all the way to death's door, and I just really appreciate God's favor. First of all, let me say, thank you for having me on this panel. So good to hear from some of our community through this panel. I greet you and thank you. I don't want to take a lot of time because I know that we're limited on time, but I did want to say I was grateful for all the hospital staff, all those that were all over the world who I didn't even know were praying and interceding for us with positive thoughts and, prayers, and how close it brought my inner circle, my friends and neighbors, my acquaintances throughout. And I really appreciate that. It started off with me. I was out and about for thinking to myself, like, well, COVID, I'm never going to get it. I don't even get sick. And lo and behold, the day I actually was sick was like on a Saturday. I thought, wow, what's that? I feel like I've been run over by a truck. And I had 4 days of fever. Doctor finally said, well, come in, let's test you over at Palmerado Hospital. And I was admitted. And from that point, they said, yeah, we're going to keep you, and went directly into ICU. And if you ever have to go to the hospital for any length of time, make sure you have your music because it is lonely. So being isolated for 6 weeks was kind of traumatic. Of course, 3 of those weeks, I didn't know anything about it. I was put on a respirator. My condition went down to death's door. I believe, the prayers and positive thoughts that went before me, really, brought me out. And I recovered about 3 weeks later and was released. They induced me into a coma under fentanyl. They threw every drug that they knew to throw at me. And I was appreciative for the doctor staff. They call me their miracle man because I shouldn't have come back. Even Dr. Robinson was telling me, he says, yeah, you probably only had a 10% chance. I think they gave my wife even less than that. But, you know, they did everything that they could possibly that would work. And after the fact, when I came to, reading the responses on Facebook and my wife's journal, I saw, you know, the responses from those all around. And we need that as a community. We need responses coming back and forth. We, as humanity, we need to, you know, be together in that. And I appreciate that. You know, I'm thankful for this platform to shine a light that's saying, you know, no matter whatever anyone goes through, it's important to know that, you know, God's favor is upon you. And all that we need to do in pursuing that is that God's faithful even when we're not faithful. And I'm thankful for God's favor, and as you are able to as well. And without going into a lot of dialogue on my recovery, like I said, after the first day I was out, I was on a walker. The second day I was moving around. Third day I was walking up and down stairs. By the end of the week, I was walking down and up there. My physical therapist said that, wow, you're just moving. I go, well, I can't sit still. It's just my nature. I've got to get moving. And it did it for me. You can do it for anyone. Any questions you have?
Yeah, other than the fever, were there any other symptoms and the chest pain? Any other symptoms that stuck out to you, or had you been in a large crowd recently before, or a week or 2 weeks before, prior to the diagnosis?
Well, I've been all over. I was in Laughlin and some shows. I'm a musician, a performing musician. I was around everybody that I had contact with. No sign of COVID or that. I believe there's carriers and there's those that, you know, are susceptible. But, you know, obviously, if you have a condition that you're susceptible, you need to take precaution. But for me, like I said, I thought my immune system was good. And it turned out to be I was one hit hard. Yeah. You asked one other question in there too.
Any other symptoms other than a fever and chest pain?
On that, I didn't have a sore throat. I didn't have, the only thing I had was fever. So no cough, no sore throat. So, you know, it was just the continual fever. Then when I actually got up there, they put like a pipe cleaner up my nose, and I thought he was giving me a frontal lobotomy, but it was part of the testing to get that diagnosis that, you know, like, okay, yeah, you need to, you know, stay here. We need to quarantine you.
Brother Alex, just wanted to say thank you. God bless you on behalf of the entire San Diego music community. We've been praying for you in recovery. Ladies and gentlemen, this is one hell of a guitarist. He is family to me personally, so I just wanted to interject here, not to interrupt the flow, but let you know that we are praying for you. We're looking forward to seeing you at a stage really, really soon. So hang in there. You were the first person that in scrolling on Facebook that I saw had COVID-19. So it's very important that, you know, I brought you here to just shed some light on God's grace, and you are with us in prayers. Keep the faith.
Thank you.
You're welcome.
Thank you.
Kristina, the floor is yours.
Thank you, Alex. Again, reiterate that for being here and kind of giving our viewers an insight, a little closer insight on the realness of this virus, because, you know, I see a lot of things on social media, even people, you know, we're talking on the phone, and some people don't know anyone, you know, close to them that has acquired this virus. So if it's not close to you, people think it's imagination. They think it's not real. But actually, it's home, and here's home right here. And you're currently still going through the process. And so bless you, and all health and wellness to you in your recovery.
Thank you very much. And thank you to the panel.
I'd like to next introduce Dr. Suzanne Afflalo. With introduction, she's a physician who has served within our community for 23 years with Kaiser Permanente. Dr. Afflalo currently serves as the medical director for the Alliance Health Clinic and is a graduate of George Washington University School of Medicine. Dr. Afflalo also serves on many boards and can be seen volunteering heavily throughout our community. Again, thank you, Dr. Suzanne Afflalo, for joining us in today's discussion. When we were talking last time, we were in the developments of a new task force, and there has been some developments in that, as I've heard, and then also some permanent testing sites. So wanted to see, get some updates on that. What's been going on?
Can you hear me from my phone? Can you hear me?
Yes.
Okay, perfect. Yes, let me just give you an update. So the COVID-19 Equity Task Force, we met for the second time Zoom meeting about a week ago, just to bring everybody up to date. Our first task was to get permanent COVID-19 testing sites in southeastern San Diego, which we were able to successfully do that. 2 of them, one at the Tubman Chavez Center that's open Monday through Friday from 7 in the morning till 7 in the evening to accommodate people that might be working. And then the Saturday site is at the Euclid Health Center, which is Saturday. So at the Tubman Chavez Center, they can take everything is an appointment only. So they can take 132 appointments at the Tubman Chavez Center every day. And on the weekend at the Euclid Health Center, they can take 75. So I'll give you an update on what's going on. So far, we started this on May 2nd with a test trial at Euclid Health Center. And since then, up to date now, we have had 1,500 people tested out of the 2,044. So we're having about, we're averaging about 97 people out of the 132 that are booked each day. We are getting fully booked, but we're having about a 25-26% no-show rate at the Tubman Chavez. So we're still trying to encourage people to get out and get tested. It's so important that they do that. Only because they are being booked, but they're not following through. So we'll just keep coming through. If we've already tested about 1,500 of our community people, we still have a lot to test. And as Dr. Robinson said, we need to test, and test. So what we're trying to do is encourage everyone, whether they have symptoms or not, to be tested. That's the only way we're going to be able to identify who might be an asymptomatic carrier and be able to successfully either have them self-quarantine at home, or if they live in a multi-generational household and no one else has tested positive so far in their household, we can certainly successfully isolate them. The county has hotel and motel rooms that we can isolate them successfully for those 14 days until they're able to safely come back to their own household with their family members. So that is the update on not only the task force, but the 2 permanent testing sites in our Southeast San Diego area. And as Carlton put up on the screen, it shows that we have 4 walk-up sites that's run by the state, and we have at least 2 permanent drive-up sites that the county is running, which is the Euclid Health Center and also at the stadium. They are going to be having some mobile testing sites and other places they'll take to other communities that are in need, that possibly are at high risk. But that's to come. So with the follow-up on that, not only in the on the equity task force, we got the testing sites accomplished. Our next goal was to work on the contact tracers and to make sure that they had representation from our communities. So what we've done is on our last meeting, SDSU's Director of Public Health Department, Dr. Hala Madanat, she presented to us and explained that they had received the contract from the county to be able to do the contact tracing in our communities of color. So we now have a task force, basically an advisory board, which they invited me to be on. So I'm very happy to be on that, to not only see the testing go through, but also to now help with the contact tracing. And it's called Communities Fighting COVID. We had our first Zoom meeting yesterday, and I'll just give you an update on that. There are several representatives of all the communities of color. And as it stands right now, the contract is for, it seems like very few, but the counties will pay for 40 community health workers from the communities of color. And the breakdown on that is right now is 23 are going to be Spanish speaking population. There's 3 demographics we're looking at right now with a 4th one to come. So 23 of the community health workers will be Spanish speaking providers. 7 will be from African American descent. 5 are Arabic speaking. And then the other 5 that are left are going to be from another language that we have to identify. So we don't know what that is yet, but that's the final 5 of the 40. And so we're going to start, there's going to be a town hall meeting. So as soon as I get the information on that, that is actually coming up on Monday. We're inviting anyone that possibly would be interested in becoming a community health worker to join in on that town hall meeting, or anyone that's interested in knowing what it's all about, to find out what is asked of them. We went over, you know, what the job description looks like, what the criteria would be, what the duties and responsibilities are, what we will provide for them in terms of equipment. Obviously they need to be bilingual for those other languages. So not only speak Spanish, but also speak English. So we don't need to use a translator. With the other languages, they will be using translators for that. But Arabic and Spanish speaking, they need to be bilingual. And then just the knowledge and abilities that they have. So, you know, they'll give you more detail, but the job description for them are going to be $15 an hour for community health workers. And then there's going to be some lead workers that will be paid a little bit more. They'll give you all the details on this town hall meeting. And then the last thing is the applications for these positions will open up on Tuesday, the 9th, which is next week. So everything is moving very quickly just from our first advisory board meeting. That's to just let the community know that we are going to be reaching out for people that represent our communities to get contact tracers that look like us, that are culturally sensitive, that will go ahead and reach out. So once we get identified on who's positive, the county will then give this group the demographics of the Spanish speaking, the Arabic speaking, and African Americans that are positive, and we will reach out to them. The other piece of that is that there are the SDSU students that are in the public health department and a few other departments are going to be doing an ongoing contacting in terms of what the needs are and if they're being met. So it's more to come. Just want to let you know that we do have an advisory board that's helping SDSU reach out and identify who the best contact tracers are for our communities. And so with that, if there's questions, I'll be happy to answer.
Great update, Dr. Afflalo. Plug in the community meeting. You said there's one on Monday. Location and time for that for everybody who's got.
Yes, I actually don't have the details yet. They were going to finalize that and get it back to me. So as soon as I get that information, I'll get it to you or Carlton. All I know is that they're planning on having a town hall meeting on Monday, the 8th. It most likely it's going to be a Zoom meeting, and I just need to get that information out to you guys. And then they'll also announce at that point that the application process will open up the very following day.
Perfect, perfect. Okay, guys. Well, in one word, I want to ask our panelists that are still here, what is our next step to healing? If you can answer that in one word, I will start with Officer Kelso, Lieutenant Kelso. In one word, what is our next step to healing?
I would say communication. Communication is the best one word I can come up with.
Okay. Dr. Robinson.
Instead of hate and rhetoric from 45, being the president of these United States.
There we go. Dr. Afflalo.
Say that one more time, Dr. Robinson. Dr. Robinson, say it one more time. We didn't hear you. What was your one word? One word, please.
Carlton, you know I'm not going to say it in one word. I said, love, not hate.
Thank you.
We have two viruses to fight. The first virus is COVID-19, but even before that should be this virus of racism and hate. In this time of COVID-19, this country still has time for hate and racism.
That is our doctor. Thank you.
Paragraph. Dr. Afflalo.
I would just say hope.
That's awesome. That's a good one. And Alex.
One word, community. Care for one another, community.
That is great. Well, guys, this is wrapping up our our session here of health and community here with COVID, and now, you know, the ongoing climate with race and the health disparities. I think that is kind of intertwined in all of that. We have a Q&A. Dr. Robinson, do you want to say something in closing as far as very short snippet, maybe 1 minute, as far as just how do they leave off from here? We're having, you know, protests going on. People are going unmasked. You know, we want to keep everybody safe, healthy, and, you know, where do you want to leave us off?
Well, I'm encouraged by what I see. I'm also discouraged by what I see. I think we still need to be careful out there and make sure we do all the things that need to be done, because this virus is going to be out there for a while. So mask, try and social distance, physical distance if you can, and do all the things that you can to protect you, your loved ones. Remember, you do not have the right to infect me, and I don't have the right to infect you, and you don't have the right to infect your family or loved ones.
Thank you. Thank you for that. Well, guys, I thank you guys so much for your participation in this discussion. Does anybody out who is watching here, any of our viewers, does anybody have any questions for any of our panelists? We have some experts here in the community that can cover a broad range of questions that you may have in regards to this virus that's affecting us now, to the protests. Is there a safe way to protest? Should we continue to protest? And, you know, anything in that realm. So do we have anyone who is watching this now that have any questions for our panelists? I just see here, what a blessing to have Mr. Alex sharing his miracle story with us. Oh, thank you and bless you. Thank you to each of you. This has been awesome information. I don't see any questions. Oh, let's see, what's this one? I don't know, any more questions? So I don't see any questions here. Oh, let's see what this is. This has been awesome information. No questions. So
Kristina, if you don't mind, real quick before you wrap things up, again, thank you to all the panelists. Thank you to you for doing a great job. And I just want to provide a few resourceful links and information, which will also be shared on the San Diego Hip Hop Health and Wellness 5K and Festival page. We have here, first slide is the Black Healing Spaces. Health is wealth, both physical and mental. A lot of us are dealing and overcoming obstacles, traumatic, family-related, finances, dealing with just social media, news, and, you know, the anger. Let's heal. A community that heals, you know, will definitely be a community that progresses here. So also, we have one of our own, Deborah Porti, that leads in a fitness training weekly. For more information, please visit the Hip Hop Health and Wellness business page on Facebook. She does a weekly virtual workout. And again, health is wealth, both physical and mental health. And Deborah, as our race director, is at the forefront of leading the community. She normally works at the YMCA, the Jackie Robinson YMCA. She is with us today in the audience, but we definitely want to shout out our own. And then lastly, we want to encourage everyone to get tested. Okay, in order for us to go back to quote unquote normalcy, and just for the peace of mind, okay, we want to know that we aren't asymptomatic and carrying COVID-19. So we want to also, like Dr. Robinson said, not rely on just the test, the negative result, to mean that we should be out and about without PPE items and practicing social distancing. But the resources are here. The Zoom meeting that we had before, I'd like to say, led to us getting, with the help of Dr. Afflalo and our community leader, Shane Harris, and our full team, led to us getting a COVID-19 testing facility in Southeast San Diego. Thank you to everyone behind that effort. Health is wealth. I'm going to wrap up the call, give the floor back to our captain, Kristina. It's 5:05, so we're doing great. One more thing, Dr. Warren, John Warren from the call, he had an emergency, but he does send his well wishes. His newspaper, the Voice of Viewpoint, will be available to all for this week's edition at Saturday's food drive at Mount Airy Baptist Church, which our team will be hosting with Assemblywoman Dr. Weber from 3 p.m. to 5 p.m. Thank you. Carry on. Go ahead, Kristina. The floor.
You were cut off a little bit at the beginning. If anybody didn't hear, Dr. Warren, he apologizes. He couldn't make the meeting today. But we wish him well. You guys, thank you so much for our second series of this panel. It's always great having you guys on board. Such a wealth of information for myself as well, you know, because I'm in the community and I'm listening too. So we gladly appreciate you and welcome you back. From the San Diego Hip Hop Health and Wellness, I'm Kristina, and we are signing off. Health is wealth. You guys stay healthy.